Hi, I'm Andrew Tropiano from Newswatch TV, and in today's health update, we're going to examine a medical condition that virtually every adult has experienced at one time or another: back pain. Now, according to government estimates, as many as 80% of the population will experience a back problem at some time in their lives, with 31 million Americans dealing with the condition at any given moment. It's one of the most common reasons for missed work, and it's the leading cause of disability worldwide. Yet as prevalent as back pain is, treating it is still very much a hit or miss proposition. In fact, Americans spend at least $50 billion each year trying to alleviate their back pain, with treatment options ranging from prescription painkillers to surgery, and often with disappointing results. However, there's a new medical technology for treating back pain that's creating enormous excitement within the health community. It's called non-surgical spinal decompression, and it's demonstrating amazing effectiveness in relieving back pain and its related symptoms without the use of narcotics, injections, or surgery. And joining us this morning from Palm Beach County, Florida, to tell us more about non-surgical spinal decompression is Dr. Eric Kaplan, the president of Disc Centers of America and co-chairman of the International Medical Advisory Board on Spinal Decompression. So first off, Dr. Kaplan, what exactly is non-surgical spinal decompression?
Non-surgical decompression is a solution for back pain. Non-surgical decompression is the alternative for back surgery. Non-surgical decompression is changing the way people are handling back pain. It's a cost-effective, gentle process that utilizes computer technology to take a herniated disc and to help retract it by segment, much different from traction. Research has shown traction not to be effective with herniations, but spinal decompression to be 86 to 91% effective. The McClure study took 500 pre-surgical cases, a neurosurgeon. After the thing, 91% no longer needed surgery. Most people are in that category of the 91%. Non-surgical decompression is changing the way people are treating back pain, one patient at a time.
So doctor, who are the best candidates for this type of procedure?
Who's a candidate for spinal decompression? People that are in pain. People that have neck pain, back pain, shoulder pain, numbness, burning. People that have trouble when they get out of bed in the morning. People that have trouble when they go to bed at night. People that have trouble sleeping because of numbness in their fingers or their toes. Pain down the leg. Pain during the activities of daily lifting. If you're lifting your children, your grandchildren, and you have pain, you probably do have a bulge or a herniated disc.
Now, Dr. Kaplan, how long does a typical treatment take?
It's a very good question. The average session probably takes anywhere from 23 to 30 minutes. It's so gentle that actually the patient often falls asleep on the table. Why? Because what we're trying to do is to get spinal distraction without muscular traction, to get the segment to open up a little bit, to release that disc, and we do that by actually fooling the body. And the software does that, utilizing a certain logarithmic index that can actually work within the body's patterns to get the body into a relaxed state to do it. Patients fall asleep, they watch television. It's a gentle process. The difference is when they get up, they feel relief.
So how does technology and diagnostic imaging assist the doctor?
I've seen a lot of changes in healthcare, and I think one of the greatest changes in healthcare has been technology. Technology has not only changed on your phones, but it's changed in the way that we as doctors deal with patients. So imagine now that through technology that we can actually diagnose you better. That technology is called an MRI exam. 30 years ago, MRI exams didn't exist, or they were not approachable and they're affordable. Today, MRIs are affordable, and it actually gives us a video image of the herniation. Is there one herniation? Is there multiple herniations on any segment? We can see this through an MRI study, and through spinal decompression, we can actually target the specific disc. Imagine, through computerization, we can target the specific disc, not pull apart the spine, not irritate it, but actually gently alleviate that and to remove that herniated disc. Spinal decompression is something that's revolutionary, but the change has been the change of technology. Technology is not only working in your homes and your televisions and your phones, it's also working in our doctor's offices on getting patients better.
Now, not all decompression centers are the same. Why is Disc Centers of America different?
You know, I'm proud to be a part and the founder of Disc Centers of America. Disc Centers of America sets the gold standard. We utilize a training program which is initially held at Parker University, and it's a national certification course of which doctors must spend time on their own to do this. Now combine that with setting protocols that are cost effective, that are gentle, accessible to the patient. Disc Centers of America doctors are the best trained. They provide a gold standard. They understand that the patient comes first, but they specialize in the treatment of disc pain.
Now, laser therapy also plays a role in concert with spinal decompression. Can you explain how it works?
Laser technology acts as a magnet to the blood, actually draws blood into the area, reduces inflammation. So imagine if we could take a herniated disc, reduce that herniation, and then through laser, we can reduce the inflammation. The patient's going to get a quicker result, a less expensive result by the most highly trained doctors in the United States.
Well, Dr. Kaplan, this has been really informative, and for the millions of Americans suffering with back pain, it's an exciting treatment option. Thank you for coming in today to tell us more about it.
Thank you so much for having me here today. This was an exciting opportunity, and I hope it was educational and informational to you as well.
Now, to learn more about non-surgical spinal decompression, visit disccentersofamerica.com.
Hi, thanks for watching that segment on Newswatch TV. I'm here with Dr. Kurt Simons from the great Milwaukee area. And this is very important to us because as I travel throughout the United States as the former president, chief operating officer of Nutrisystem, the weight loss company, as the founder of Disc Centers of America with my partner, we look for the best of the best, being one of the largest disc centers throughout the United States. And we're here, Kurt, today to honor you for the work that you're doing. We met you at the National University Certification Program. We got to know each other, and we were excited with your passion and commitment to people with disc injuries. I mean, people today, disc injuries, we now have an 86 to 91% success rate. And if you're in Milwaukee and if you're looking for the best of the best, Dr. Simons here is the one that I'm going to recommend. Kurt, tell them a little bit about yourself, your practice, and where they can find you.
I'm in Brookfield, Wisconsin, right next to Pewaukee on Capitol Drive. I've been in practice for 24 years. We've always strived to stay on the cutting edge of technology and treatment to offer our patients different alternatives to drugs and surgery. And one of the ways that we're doing that is with disc decompression for herniated discs.
So if you're looking for the best of the best, if you got back pain, leg pain, pain radiating down your arms, your hands, into your feet, trouble getting up, trouble bending, having trouble with the simple things of activities of daily living, like lifting your children, then maybe it's time that you be examined. And if you're in the Milwaukee area, there's nobody better. And Kurt, again, we want to honor you and acknowledge you for the great work that you do, and thank you so much.
Thank you.
Disc Centers of America, a call to us can change your life.